great to be back. I'm Dr. Sally Bell, and this is our nutrition session. We have an all-female panel for you, so it's very exciting. Just, the reminders around this is recorded. There's going to be an opportunity for questions later, so please do pop your questions in the chat as we go along, and I'll be feeding them to the panel later, and just to keep the chat polite. So yes, welcome to our nutrition talk. And so as I said, I've got three panelists who are going to be talking to us, and we're thinking of the idea of nutrition in terms of the impact on health and this concept as food as our medicine. I'm going to be sharing just a little bit about setting the context of that, and then I'll hand over to our first speaker. So I'm a GP. I've been a GP for 22 years, and I have an interest in lifestyle medicine and nutrition, and specialise in women's health. I have a small clinic that I run. I've just stepped out of the NHS as a GP after 22 years. And I'm also really passionate about real food, and I'm an ambassador for the Real Food Campaign, Venna Nutrition, and an advisor for Slow Food UK. And when we start looking at the issue of health, it's a real problem, isn't it? We have statistics at the moment around our health crisis where 1 in 2 of us are going to suffer with cancer within our lifetime. 2/3 of the adult population is overweight or obese. We have 5 million diabetics, 90% of which are type 2 and reversible, and we spend £10 billion a year on diabetes, 80% of which is due to the long-term effects of diabetes, all of which are reversible if we can reverse diabetes. We have issues with dementia in our elderly. Actually, I was really shocked this week to read a statistic about people who are born in this year will go on to have a 1 in 3 chance of developing dementia in older life. And we have escalating problems with mental health. 1 in 6 adults have sought help for their mental health this week with their GP if they can get in. We've had 5,000 adults commit suicide this year. And we have escalating problems with our children as well, with 50% of our children have a medical diagnosis by the age of 18. It is really alarming, and these aren't just dim and distant statistics. These tear at the heart of all of us. We all have stories of our own health, our own families, our own communities. And certainly my experience in general practice, I got halfway through my medical career and felt more like a pharmaceutical vending machine than I did a doctor. I was tired of treating diseases and not people, tired of looking at a part of you and not the whole in a very time-restricted system, and tired of the disconnection from you, from your family and your culture, and really not being able to treat the whole of you. And here's the thing, like, the NHS is wonderful, and I don't want to knock it. Like, there is a need for specialised care. It is fantastic at acute care. If you have an accident, you don't want me in A&E standing over you talking about broccoli and cruciferous vegetables. You want, that acute care. However, when we start looking at some of these diseases that I've mentioned, these chronic, these non-communicable diseases, and you start looking at the root of what's causing them, 10% is thought to be genetic, and depending on what study you look at, 80 to 90% is to do with lifestyle. And lifestyle problems require lifestyle solutions. And it comes back to some really basic principles, how we sleep, how we move, how we tackle our stress, how we connect with ourselves, with others, and with nature and purpose, and how we eat. But certainly when I started using this as a way to help people recover their health, which has really helped me fall back in love with medicine because it's so effective alongside conventional medicine at times. Certainly when I started to look at the nutrition piece, I found it incredibly confusing. And as doctors, we are not taught any nutrition. And you look at the research and you'll have Professor so-and-so saying high fat and an equally academic professor saying low fat. And oh my goodness, it is so confusing. But over the years, having dug really deep and taken training, I think what's really, really clear in terms of the food message for the nation is that 67% of our calories come from ultra-processed food. And without a doubt, wherever you sit on the spectrum, whether it's vegan, paleo, whether you eat meat or don't eat meat, vegetarian, fish, whatever, the key thing that will impact the health of our nation is eating real food and not eating ultra-processed food. And then I think within the context of that, you know, why are we talking about this at a food and farming conference? Because I think it's really, really clear that, you know, the quality of food is also really important, how far it has traveled to get to our table, the diversity of food that is available to us. There are very similar stories with farming and with health. Like when we get our gut microbiome and those bacteria right, the rest of our health often follows. And it's a very similar story with farming. When we get the soil microbiome right, that supports the health of plants and animals and produces better produce. And that's without even starting to look at the impact of things like glyphosates on human health. And I think the story around soil health, farming and food production and human and planetary health are one story. And this is why we need to have this lovely joined up discussion. So welcome. Do pop your questions as we go along. Our first speaker that's going to be speaking to us today is also a fellow ambassador for the Real Food Campaign, Eilish Blade. And Eilish is a registered nutritional therapist with BANT, and she received her MSc in 2020 and works as a nutritional therapist, but has this lovely background where she has a BA in green studies. She's always been involved sort of at grassroots environmentalism, and I was even involved in growing, you know, in Northern Ireland using permaculture methods. So she's got this whole sort of very joined up approach to food. So it's a real delight, Eilish, to have you join us. I'm looking forward to hearing what you have to say. Over to you.
You're on mute, Eilish. Thank you.
Hi, am I okay now? Is that
Perfect?
Okay? Great. Okay, welcome everybody. Lovely to see you. And that was a lovely introduction, Sally. Thanks very much indeed. So I just want to jump straight in to discussion about nutrition. And this is something I'm very passionate about. So nutrition is part of the solution. So I want to look at the relevance of nutritional health in fueling both an epidemic and what we now know as a COVID pandemic. I want to look further at what a healthy, sustainable diet would look like in Wales and how that would actually help to impact health outcomes. So next slide. So as Sally has said, diet lifestyle related diseases have been a major burden on the NHS. And prior to COVID, we had an obesity epidemic, which is now escalating. COVID is actually, through the lockdowns, obesity has escalated in young people and in adults. And unfortunately, Wales has the highest prevalence of diabetes in the UK, and 1 in 4 classified as obese. Now, I thought this was really apt. In the Lancet in 2020, Richard Horton described what we're experiencing not as a pandemic, as a syndemic. And this is particularly relevant to Western countries like the UK and the US. So it's 2 categories of diseases which interact within the population. So we have SARS-CoV-2 and then the array of non-communicable diseases. And basically this is underpinned by a background of social inequalities. So obesity and impaired metabolic health have consistently been reported since April of 2020 as affecting the outcomes from COVID. And hence we have patients who are suffering with diabetes, hypertension, cardiovascular disease, dyslipidemia, obesity. And these are the people where we're seeing the severe outcomes and fatalities in the highest numbers. And next slide. So in tackling chronic metabolic disease and the associated fatalities, we need to focus on the nutritional science. What do we eat? Real food. Why do we eat it? What is the benefits and health outcome? And a good place to start is looking at gut health. And this is because it is key to the whole body health. The gut has a number of bidirectional links to other organs and systems in the body, such as the gut-brain axis, gut-lung axis as well. And hence a healthy gut contributes to a stronger immune system, better cardiovascular health, better mental health, sleep, mood, optimum digestion. Next slide, please. So when we're talking about gut health and immunity, essentially what we're focusing in on is the gut microbiota, which is the trillions of microorganisms, of bacteria, viruses, fungi, protozoa. And what we want to think about is an ecosystem which is balanced, where we have healthy numbers of commensal beneficial bacteria, you know, which outnumber the pathogens. We need a balance. And with this balance, we promote better gut function, protect the body from infection, and help regulate metabolism. The gut-liver axis is important, so metabolism can actually be promoted in a better health through actually better gut health as well. If we also think about the gut itself, it has this mucosal layer, which is there for immunity and protection. And within that mucosal barrier, we have secretory IgA, which is our frontline protective antibody, and has been really important, and is also really important for protection against virus bacterial attacks as well. And one of the key things I think we need to remember is approximately 70% of the immune system is housed in the gut. So where do we start with immune health? We need to focus on the gut. Next slide. And I wanted to put this in for all the growers and just make that connection between the soil and the gut microbiome. So the soil microbiome likely formed in tandem with the gut microbiome. I think that's a lovely way to think about the context of evolution. And it's all again to do with the balance of organisms and keeping it healthy through the right input of healthy substrate, plants, plant material, soil, and fermented foods, things that we need to contribute to healthy diversity of commensal bacteria in the gut. Next slide, please. So a lot of interesting research about COVID and gut dysbiosis. It's primarily, we know that in chronic metabolic conditions, gut health is already impaired, and this has a knock-on effect on the immunity. So ultimately, people with conditions like diabetes, obesity, they have a predisposition to have a more severe outcome from COVID. The gut microbiome is involved in the magnitude of COVID's severity, and this is through changes in the immune response. And it was really interesting to see that several of the really important healthy commensal bacteria that we need to regulate the immune system are absent or low in patients with COVID. This further causes dysregulation of the immune system, and in terms of resolving inflammation, this is where things are not happening. So as we go into long COVID, this pattern of continued dysregulation of the gut microbiota continues. Next slide. So when we thinking about health outcomes, what is a healthy and a sustainable diet in Wales? What does it look like? And yeah, what are the key foods, the Welsh superfoods? Next slide. So when it comes to a diet that is considered optimum for gut health, there is no consensus about what the best diet is. It is, as Sally said, it's about real foods. It's the avoidance of ultra-processed food. But again, going from like vegan, vegetarian to flexitarian, you know, they can all encompass benefits for the gut microbiome and conferred immunity as long as it is real food. So I've just tried to hone in on some foods here, which as far as I know, that these are all compatible with being grown in Wales and will be beneficial for health. So heritage grains, I know there's heritage grains grown down the road here in St. David's. They have been shown to have a better mineral vitamin content than standard commercial grains. Pseudograins, quinoa can be grown in this country as well, and particularly relevant for people with gut issues. Obviously, we want to have a diversity of fruit and vegetables to provide adequate dietary fiber for the gut bacteria as a good substrate, and all the colors in terms of all those beneficial polyphenols as well. So when it comes to protein, I think, right, that's okay. When it comes to protein, I think one of the key points for me is that when we're considering meat, it's about eating nose to tail. So we have crucial vitamins and minerals that we can get from liver and heart. We can get antioxidant CoQ10, vitamin A, really important for immunity, and also with shellfish, often ignored, but again, something that can be farmed sustainably in Wales and contributes to significant amounts of zinc for immunity as well. Next slide. Fats, really, I think it's just basically okay to say that, you know, plant-based and animal fats all have benefits, and, you know, that ratio is going to vary for people. I've included functional foods, my favorite being sourdough bread. I did my MSc dissertation on sourdough bread, looking at how it was beneficial for people with IBS to eat sourdough bread and actually helped to reduce certain symptoms associated with irritable bowel syndrome. Seaweed, something else I love. It's very beneficial in terms of selenium iodine content. For me, on a practitioner level, I regularly see clients have very low amounts of selenium and iodine when I do a dietary analysis. But it also has another very key health beneficial quality, which is they have polysaccharides, which are really important to help with the mucosal layer of the gut.
One more minute, Eilish.
Okay, next slide. So overall, it's about looking at nutrition and avoiding overnutrition from processed foods, nutritional inadequacy. These contribute to severity of outcome in COVID. Next slide. So in exiting this syndemic, I think, first of all, we need a real acknowledgement of the role nutrition has played in increasing disease susceptibility. So we had the Healthy Wales, Healthy Weights delivery plan. This stalled at the beginning of COVID. It has re-emerged again, and it has acknowledged the link between overweight, diabetes, obesity, and COVID. So in moving forward, a multifaceted approach, we need to work at a patient level and a public health level to include nutrition as part of this exit plan and look at ways to actually help with weight loss and improving metabolic markers in the population.
Thank you, Eilish.
Did I manage?
You did perfectly. So thank you so much. I mean, it's just
thanks everybody.
Totally brilliant. And I mean, I think it was the father of medicine, you know, Hippocrates said, you know, all disease starts in the gut, and here we are 2,500 years later, yes. Actually demonstrating, and the science is catching up with this. Wonderful message there about the importance of gut health. Wonderful message about actually we can change that within days, can't we, by just getting
yes.
into a real food diet, diversity, eating the rainbow. If you eat, you know, animals, then having quality protein, unprocessed again, meat, you know, can all serve to improve our gut microbiota and in turn impact health. So such a simple message, but such a powerful message. So thank you, Eilish. So our next speaker is Dr. Elizabeth Westaway. She's actually pre-recorded her talk today because she was a bit unsure about the connectivity with her internet. So Elizabeth is the co-founder and director of Growing Real Food for Nutrition, a CIC. She's also got a wealth of experience. I just love listening to her so much. You know, she's an international public health nutrition specialist, worked in many different settings overseas and here, and has a PhD in international development. So thank you, Elizabeth, and we're looking forward to hearing your talk. Again, do pop your questions in the chat if you have any questions as we go along.
Good morning, everyone. My name is Elizabeth Westaway, and my presentation is entitled Nutrient-Dense Food Supply Chains, Transforming Our Food Systems with a Nutrition and Health Lens. Now, the world is experiencing several concurrent emergencies, particularly climate change and biodiversity loss, as well as the often overlooked health emergency. This diagram on the right illustrates the pivotal contribution of biodiversity towards good health and well-being of people and our planet, of One Health. However, the worsening biodiversity loss stemming from human separation from nature has resulted in food systems that are not working for people or planet, where people are fed by the food industry, which pays no attention to health, and are treated by the health industry, which pays no attention to food. So as a public health nutrition specialist, I'm particularly concerned with the health emergency, which is resulting in a syndemic of diet-related non-communicable diseases such as type 2 diabetes, heart disease, stroke, and certain cancers, which are disproportionately impacting disadvantaged individuals, their families and communities, and the healthcare systems that serve them, such as the NHS. Now, by looking at food and farming systems with a nutrition and health lens, we can start to change the agricultural paradigm to produce food that is good for people and planet. In 2010, the Food and Agriculture Organization of the United Nations, FAO, developed the concept of sustainable diets, which are protective and respectful of biodiversity and ecosystems, culturally acceptable, accessible, economically fair and affordable, nutritionally adequate, safe and healthy, while optimizing natural and human resources. Hence, FAO defines sustainable diets as diets with low environmental impacts, which contribute to food and nutrition security and to the healthy life for present and future generations, thereby respecting planetary boundaries. Our food choices can make a difference to people and nature. Hence, it is important to be aware of and ideally follow the principles of a healthy, balanced, diverse, and sustainable diet. Choose sustainable food. Eat more plants than animals, so eat a higher proportion of plant-based foods relative to animal source foods. Eat healthy and minimally processed foods. Ensure balance and variety. Also check your national dietary guidelines and find sustainable options that fit the health guidance. Now, since this guidance recommends eating more plants, an important food group is fruit and vegetables, and countries around the world have run behaviour change campaigns to get children and adults to eat more fruit and vegetables. It's commonly assumed that all fruit and vegetables are a rich source of vitamins and minerals and phytonutrients, including antioxidants and polyphenols. However, I would like to present some research that shows that this is not the case, and that how you grow fruit and vegetables is a key determining factor of crop nutrient density. Growing Real Food for Nutrition is collaborating with the Bionutrient Food Association's Bionutrient Institute in the USA, which has been researching crop nutrient variation and developing a bionutrient meter to ensure crop nutrient density, or to measure crop nutrient density over the past few years. In 2018, hundreds of samples of carrots and spinach were sent to the Bionutrient Institute laboratory and analysed for 16 elements, such as minerals and phytonutrients, including antioxidants and polyphenols, which are important for human health. So what did they find? Well, in relation to mineral elements, there was wide variation. In spinach, iron varied by 14:1. In carrots, potassium varied by 15:1. So that one carrot with the highest level has as much potassium as 15 carrots with the lowest level. Note that most of the values cluster at the lower levels. Now, with regard to antioxidants and polyphenols, levels also varied widely. In carrots, antioxidant levels varied by 90:1 and polyphenol levels varied by 200:1. Again, note that most of the values cluster at the lower levels. So it's clear that a carrot is not a carrot. They vary considerably. Now, the Bionutrient Institute wanted to learn how to grow nutrient-dense food. And in 2019, over 3,000 samples of 6 crops, carrots, kale, cherry tomatoes, lettuce, spinach, grapes, and samples of the soil in which they were grown in, were sent to the Bionutrient Institute laboratory. The crops were analysed for the 16 elements. Soil analysis looked at soil carbon, soil organic matter, minerals, and soil biology. Data was also collected on crop management practices, including crop variety, cover cropping, and tillage. Again, they found dramatic variation both in levels of minerals and antioxidants and polyphenols. They also found that antioxidant polyphenol levels varied by crop management. The lowest levels below the median were in the crops produced hydroponically and in greenhouses. Biodynamic certified crops were below the median. US organic certified crops were around the median. Organic but not certified crops were above the median. However, the highest levels of antioxidant polyphenols were in crops produced by regenerative practices such as no-till and continuous cover cropping. They also found that taste can serve as a useful indicator in predicting nutrient density. Now, observed variation in crop nutrient density did not correlate with local, organic, or any other labelling or marketing type. And Dan Kittredge, the Bionutrient Food Association's founder and executive director, considers that labels like organic or regenerative or local or non-GMO do not correlate to the inherent nutritional quality of the crop and are effectively process standards, not quality standards. So to avoid the need for a bureaucratic certification system, the Bionutrient Institute has been building and calibrating a handheld bionutrient meter, which you can see on the right, that anyone from a grower to a citizen can use to get a real-time, non-invasive assessment of the nutrient density of the food they want. Now for citizens, that will be prior to purchase. Growing for Real Food for Nutrition, that's Griffin, has been busy running a number of activities to build the evidence on nutrient density. We've set up a demonstration mandala garden at Matara Health and Wellbeing Centre in Gloucestershire, trialling 3 different growing practices. We've also been running a citizen science project with over 50 growers and partners from the 4 nations of the UK, with some of the global south as grower partners, learning how to measure the nutrient density of their crops this growing season. Griffin was commissioned by Jenny Rathbone, FMS, in Cardiff Central to measure the nutrient density of fruit and vegetables sold in 5 retail outlets in Cardiff, and results were included in the Senate debate that she led on nutrient density of local fruit and vegetables, and this was very well received by the Deputy Minister of Health. Griffin has also been talking with different laboratories in the UK to set up a Bionutrient Institute UK laboratory to enable grower partners to send crop and soil samples for analysis, with results providing a UK baseline and helping to calibrate the bionutrient meter. Now, interesting connections between plant health, food, and human health, as well as soil health and agriculture, is increasing. In 2020, the Rodale Institute of the USA published their report, The Power of the Plate, the Case for Regenerative Organic Agriculture in Improving Human Health. And the report highlighted a prevention-based approach to human and environmental health through an organic, whole foods, plant-forward diet that begins on farms that work in harmony with nature. The report concluded that the link between soil health and human health is largely unexplored and must be advanced. So in 2021, the Croatan Institute of the USA published their report, The Regenerative Agriculture and Human Health Nexus, Insights from Field to Body. The report defines regenerative agriculture as agriculture practices that seek to improve the nutritional value of food. It offers a framework for categorizing and better understanding different levels of nutritional intervention, from the most basic level of replacing unhealthy foods with healthy foods, all the way to considering nutrient density and interventions that improve human microbiomes. The report reflects that growing more nutritious food does influence human health and calls for a new vocabulary, because how we talk about nutrition and nutrients does not yet adequately capture the complexity and dynamism of food. We may never completely understand exactly how nutrient density influences human health, but we know enough to act. So this sentiment of food as medicine is shared by Charles Massey. If people ate truly nutrient-rich food out of healthy soil, you would slash the National Health Bill straight away. Growing Real Food for Nutrition is promoting nutrient-dense food and short, local, nutrient-dense food supply chains as a regenerative solution to the different global emergencies, particularly to improve population health through food as medicine. So I would like to invite you to join our journey as we help to transform food and farming systems. Thank you.
Thank you so much for that, Elizabeth. Just fascinating. I mean, there's this whole journey, isn't it? I mean, it's just such music to my ears, like hearing this and hearing fellow colleagues talk this way. And this kind of journey that we have with convincing that nutrition is important in health, you know, understanding that it's not just calories, that it's the building blocks, it's impacting gut health, it's impacting our genetics, right through to then this thing about how it's grown, how that impacts the nutrient richness of that food and the impact that has on our health. It's just, you know, is that one story, that one connected story, and as well as that wonderful thing where food connects us back to the land, back to nature, back to each other, as we shorten those supply chains, the impact that that has on human health too. So let me introduce our next speaker, who I'm really excited, because it's an amazing, there must be amazing food producers that have wonderful products, but how do we get people eating them, you know, and what are the obstacles to that? So our next speaker is Dr. Laura Wilkinson, and Dr. Laura Wilkinson started her career at the Nutrition and Behavioural Unit within the School of Psychology Science at the University of Bristol, where she got her PhD. She's also spent time working in the Consumer Science Department in a multinational food company, so brings some insight and wisdom from that too. And then more recently, she joined the Swansea University, well, not in 2015, and is now a senior lecturer in psychology, where she continues her research on eating behaviour within the Swansea Nutrition, Appetite and Cognition Research Group. So really delighted to welcome you, Laura, and certainly when we met on our Zoom call planning this, the insight that you brought was just amazing. So welcome, and I'm looking forward to hearing what you have to say, so welcome.
Thanks, Sally. Okay, let's share my screen. And so, as Sally said, the kind of bit of the story that I'm coming in is thinking about how we can ensure that we consider and account for the consumer in all of our plans about a changed sustainable food system that really has a focus on real foods, and, you know, thinking about those benefits that both Eilish and Elizabeth have talked absolutely beautifully about already. So food consumer psychology is nothing new. It's been around for decades. And in fact, what I've got on the screen here now is an extremely famous book from a consumer psychologist called Howard Moskowitz, and that you may have come across because it's very famous for transforming the way that we consume these pasta sauces. But of course, the trouble is that a lot of these products that these kinds of approaches are being applied to are in kind of big industry food production, and also a lot of times these ultra processed foods. And the reason why people are applying these methodologies is because we know that many products fail when they reach the supermarket shelf. And failure rates can be surprisingly high. And I think one of the things that I'm really passionate about is ensuring that the products that fail are not disproportionately those that are being produced with the kind of high standards and innovative real food approaches that we've been hearing about during this fantastic conference. So what are we talking about when we talk about consumer psychology methodologies, and how can we apply them to the kind of foods that we're passionate about? And I really kind of want to get across the message that we need to go beyond kind of basic liking and the idea of doing, you know, just taste testing where we say, oh yeah, that's quite nice, yes, people my friends like it, and things like that, and And it goes beyond that to apply kind of a systematic scientific methodology to understanding ideas around desire to eat and satisfaction and things like that, but also thinking about liking over time and how things change over time, because they can change dramatically. Thinking about the way that labeling is received, portion size, and also thinking about how people differ, so these individual differences, and accounting for the way that people receive these foods in different ways. So I've got an example study that we've just finished running in the snack group at Swansea University. And this was funded by the ESRC and is in conjunction with the NutriWales cluster. And I was really pleased to hear Eilish earlier talk about seaweed and what a fantastic food that is, considering things like the gut microbiome, because the example that I'm presenting to you today is about seaweed. So what we did is we wanted to provide these kind of umbrella consumer insights to all of the small and medium enterprises who are members of NutriWales cluster, and provide some of this kind of consumer insight that can be used to inform the way that products are put onto the market. So we had two research components to our study. So the first one was an online survey, and we were able to look at a range of different foods that had seaweed as a part of them, but also the notion of seaweed or algae-based foods in general. And you can see here that we looked at a whole host of different properties, so from taste and edibility to perceived healthiness, calories, naturalness, degree of processing, you know, all of these different things. And then in terms of outcome measures, we were interested in readiness to adopt, willingness to try, willingness to buy, and liking. So we were looking importantly for these drivers of consumer acceptability. And then our second part of our study was our focus groups, where we were able to garner a breadth of different ideas about seaweed-based products. So really in-depth, rich, qualitative understanding about the opinions and beliefs from consumers. And together, these provide us with a picture. And I really just wanted to kind of say for a moment that we were very, very careful about who took part, because there are a lot of studies out there that exist already that have tended to have quite a self-selecting sample, where people who take part in the studies are already very enthusiastic about these sorts of real foods and sustainable foods already, and they provide a very skewed picture of consumer acceptability in a general sense. So we really want to make sure that we are testing people who are representative of the potential market, you know. So this could be somebody who's just walking down the aisle of any supermarket type thing. And that's what we were very careful to do for these two studies. So we had a very large sample size for our survey, 476, and we had a smaller sample size for our focus group, which is quite normal. So in terms of our focus groups, people mentioned all sorts of different things when it came to the idea of algae and the acceptability. And most of them you will probably think, oh yes, that makes sense. So, you know, we had people mentioning healthiness, sustainability, whether something was locally sourced, the price, edibility, the importance of recipe ideas, because people didn't know how to use the ingredient, and so on. But one of the issues, this is a great way to gather, you know, lots of thoughts. But what we wanted to do within the quantitative questionnaire was to really look at, well, which one of these things is actually differentiating between people who do go ahead and buy that product and go ahead and eat it, and between people who don't. So what is it that's actually differentiating between people? And one of the things that we found when we use statistics to do this, to answer this question, and we found that actually whilst people, you know, did hold these beliefs about healthiness, calories, naturalness, all this sort of thing, it actually didn't drive their behavior. What drove their behavior was their belief that the food that they would be provided would be tasty. And then to a lesser extent, their familiarity. So this was a very large effect size, and this was a much smaller effect size, although both were significant, whereas these were not. And so, you know, one of the ways that we can interpret this is to ensure that as we're communicating with our potential consumers of our product, that we are not spending time on things that people are kind of taking for granted and not actually driving their behavior. They're not differentiating between different types of consumers, but rather spending time ensuring that they are convinced by tastiness and becoming familiar with the idea of a product and so on. So that brings me to the, I've lost track of my timing. I'm so sorry. So that brings me to the, Laura. Sorry?
But 1 minute.
Oh, perfect. Oh, great. So that brings me to the end of my presentation. So I want to do a big shout out to my PhD student, Rochelle Embling, who ran this project. And I just wanted to tell you that the results of our work are freely available to people if they would like to take a look, and you can use this QR code with your phone to go on to our little food consumer interaction website, and on there you can find a PDF infographic of all of our findings that you are very welcome to take a look at. It's going to be completely open access to people. Thank you.
Thanks, Laura. It's totally brilliant, because I think it's one of the things that we just don't often think about. You know, we kind of think, well, it's healthy, so people should eat it, and or you know, the doctor says it's healthy, so they should. But understanding, you know, I was really shocked when you presented this to me, because I am one of those select few where you kind of get into your bubble of sustainability and eating good food, and so I would want to know about, you know, is it healthy and what's it got in it. But then just forgetting, actually, you know, getting people to eat that, it has to taste great, you know, and there has to have an element of familiarity, and for food producers to understand when they're selling direct to market, the importance of that is so key. And actually thinking really scientifically and logically and systematically about how they present their products, and how we get people eating that is key. And certainly, you know, Big Food are on it. And they know how to do this, and they know how to play us, and they know how to get us eating ultra processed food. So we need to steal that wisdom and be using it to actually promote these wonderful foods. So thank you, Laura. Laura's not feeling well today, and she's, you know, you've presented beautifully. We couldn't tell, so I'm so grateful that you've still come and brought your wisdom. So we have about 20 minutes for questions. So if you want to put questions in the chat to any of us, and I'm going to get my glasses on so I can see what's coming in. I know there was just a question there about purchasing seaweed. I don't know whether you ladies know about where it's possible to get seaweed from in the UK. Often when you're searching for it, you know, in Whole Foods, it's either from Korea or Japan. So I don't know, do you know, any of you know? Eilish? Yeah, Eilish.
Well, there's a community supported group here in Pembrokeshire called Karen Moore, who are farming seaweeds along the coast here. So I know that's in infancy, but that's definitely a good start.
Right, thank you. Great. Here's a question for you, Laura. We touched on this when we had our Zoom chat, when we all got together, and I loved your explanation. So there's somebody here saying, you know, maybe also there's an element of training your palate and getting used to moving from different tastes and textures. You know, you just tell us a little bit about that and how actually ultra processed food really tickles those those parts of our brain that heighten our experience of food.
Yeah, absolutely. So there's models that are out there that really kind of take into account repeated exposure to different types of foods and the way that can change our perception of, and in fact going beyond our perception to our preference.
So I can't really talk. I'm running.
And actually our preference for foods. And so what we need to do is that's absolutely right. You know, there is a certain degree where we need to be training our, for want of a better way of putting it, training our palate towards real foods and ensuring that people don't give up on the exposures. You know, repeated exposure, especially within children, is extremely important with fruit and veg. So just keep going with it.
No, that's totally brilliant. And certainly from a clinical perspective, you know, I have many people coming from different backgrounds, and actually sometimes I start introducing whole foods alongside their ultra processed diet because I just want to get some nutrition in them, and just, you know, almost run things parallel as I'm doing that, and then they'll start to reap the benefit in terms of, you know, improvement in gut health and some more nutrients, and then, you know, you also tackle their sleep and their stress, and they're in a better position to start making that transition. And particularly with children, like I had a moment with one of my children recently where I've got them on dark chocolate. They never have normal chocolate now, and I gave them 50%, you know, the other day, and they went, "Oh mum, this is really sweet." And it's like, oh my goodness, I have managed to train my kids, you know, their palate, and it does take time. And I think as clinicians, understanding that as marketing your product and as you're feeding your families, like to suddenly go, okay, right, we all need to eat real food. No, there is a transition in that, in terms of adjusting to and getting used to those textures and understanding the addictive nature of ultra processed food. So fabulous. Let me just have a look. People have put a few suggestions around seaweed, where to get it from. So have a look in the chat if that was your question. Jade Phillips also, Jade's feeding the questions to me. How much does advertising influence overall the categories in your research? Advertising has been directed at making money, not health. What are your thoughts on that, Laura?
Yeah, and there's it's really intertwined, because there's this thing called the halo effect, where you have these kind of these labels that are not actually really to do with health, being having this, what's literally a halo effect, where people think that a food is really fantastic when actually the label isn't to do with health, but then they kind of interpret it in that way. So it's really difficult to disentangle these things for the consumers, because they are quite confused. And I mean, I'm running a study at the moment on sustainability labels of different types, and looking at people's understanding, which is extremely variable.
Yeah. So if we've got food producers, you know, here that want to get really savvy about that, then they need to kind of follow you and get in touch, and maybe you can point them in the right direction, Laura.
Yeah, and you know, it's something that you know, if you're wanting to run this kind of research to find out, is I worry sometimes that people don't know that they can collaborate with academic institutions, and it can be a really cost-effective way of running consumer research of the sort that, you know, these big multinational companies, they have people like me in-house who are doing this. And that's where I did some of my training. So I know that that's the case. So you can collaborate and work with us, and we can help you to, you know, have these skills.
God bless you. Oh, you're doing so well, honestly. Thank you so much. Just a question to, Eilish or Elizabeth. So there's one here about how do we champion the real food diet while being mindful of societal justice issues, e.g. poverty, lack of education, also access to real food. I mean, I have some thoughts, but I've been talking enough. Elizabeth? Yeah.
Yeah, I was going to say, if growing nutrient-dense food becomes the norm, then we'll be having high quality food that does benefit our health coming through food supply chains. So it's really important that the government starts investing in helping growers transition away from industrial farming practices towards regenerative practices, which have so many of these benefits, not only sequestering more carbon, increasing biodiversity, improving soil structure. You're not using any toxic chemicals or synthetic fertilizers, polluting watercourses, and you're producing this high quality nutrient dense food that's going to be benefiting our health. So that's what I would like to see.
Yes. Eilish, do you want to add anything to that?
Well, I suppose, when you're considering poverty and especially, urban areas, I think there needs to be this move to, increase availability of allotments, community gardens, so that actually it's a whole process of growing as well, so that people in urban areas can get to a piece of land and actually with their families get involved in that basic process of growing and obtaining food themselves, which is cheap to produce. So it's having that hands-on approach. And yeah, we need support for our, small independent businesses, for our markets as well, to make sure that price-wise as well, that things are available. Because at the minute, to go buy a loaf of sourdough bread it's expensive. Yeah, £4 plus. It's not the cheap option.
Yeah. Some of my thoughts on that is we've got a lot of CSAs, community supported agriculture, which actually can make, even to the inner city, there's stuff going on in London with CSAs where you can be involved and get a box scheme at such a great price compared to getting your Abel and Cole box, if that's what you can afford. I'm an ambassador with Venna Nutrition. They do a box scheme again, supplying this through local city councils. And this opportunity as well for where farmers are now selling direct, which for me, helping people move away from supermarket shops and buying directly from farmers, having this nose to tail approach, helping people understand actually, those cheaper cuts. If you've got a one pot or you can cook anything in it. But it extends to education. Like, I was an inner city GP for 15 years. I lived on that inner city estate as well. My kids were educated on it. And there is, a reality where I'm doing home visits and there's no cooker and there's no knives to cut food, and there's no understanding of how to cook food. So it is joining the dots, isn't it, between everything, that we have to be having these joined conversations around farming, where our food's coming from, our accessibility to it, education in it, the equipment to be able to cook, the confidence to cook. And I'm excited, somebody's put a question here about how do we plug into this. There's lots of conversations going on, Slow Food UK, Real Food Campaign, where, doctors, nutritionists, growers are starting to have these conversations, teachers. And so it is going on and it is growing, and it's connecting into that and having that common voice as we approach people's health. So yes, just let's finish with one last question, and then each of you have got a minute to give your last thought. There was one more.
Sally, yeah. Just to say, we're going till 11:30.
Oh, are we? Oh, okay, sorry, I've got it in my head, that's fine. So there's another question about when will GP training change to include these new, in inverted commas, ideas on nutrition. Yeah, Elizabeth, do you want to comment, or I can comment?
I think, Sally, if you want to comment about that.
Okay, yeah, so It is happening. Like, things are changing, you know, thanks to people like Dr. Rangan Chatterjee, who has really pushed forward the idea of lifestyle medicine and nutrition. You know, as GPs now, when I started this, you know, 10 years ago, there was nothing really going on. But now as GPs, we can actually go and get a lifestyle medicine diploma. We can go and do a course on prescribing lifestyle medicine. I know in certain universities like Bristol, sort of Nutritank, which is, you know, which again is just, it's come from grassroots, it's coming from the students demanding that actually they have access to this kind of education. So we know as GPs that the system isn't working. It is total lunacy to keep medicating, and we need the skills and a system to support that, because 10-minute consultations don't cut it. You know, having health coaches, having an approach that helps people change lifestyle. There are discussions going on. And I think in the interim, like, you know, if you've got somebody sick in your family, well, you can't wait for us to catch up, you know, in 10, 20 years with our training. It's finding trusted voices and you know, knowing who to trust. Rangan Chatterjee is lovely in terms of his balanced approach to lifestyle medicine. He's a trusted voice in the nation for us in the UK. You can find me on any social media handle, Dr. Sally Bell, you know, often just talking about these things, hoping to give a balanced view of how to recover health. And I think, you know, a lot of it is taking control of your own health, because there's so much you can be doing on that health journey, and it's finding those trusted voices on that journey. But it is coming. It has to come.
Sally, can I just come in on the nutritionist angle of that? When I did my master's in public health nutrition 20 years ago, soil was mentioned once in the entire one-year course, and that was in relation to iodine deficiency disorders. And I can remember it clearly. It was saying that, oh yeah, iodine deficiency disorders like goiter tend to, you have a higher prevalence in mountainous areas where the rain leaches the soil, leaches the iodine out of the soil, and then, you know, the population become iodine deficient. So, you know, that was it in terms of soil, and it just sort of, you know, has no significance for you at all. And here I am now 20 years later, and soil health is really my priority, because it's, you know, if you get healthy soil full of high quantity and diversity of soil microbes, then you're set to actually have this better carbon, water and nutrient cycling, and actually be producing food that has all these vital minerals and nutrients, phytonutrients that we need to improve our health.
Yes, great. So a couple more questions, I think. Yes, we have time. What are your views on pasture-fed meat? A growing number of farmers are selling direct. You've got people like Pasture for Life Association, haven't you? Not using inputs, and the meat has high nutritional benefits. That's reference probably to some of the research coming out of Newcastle. So yes, Elizabeth, what are your views?
Yeah, I mean, I think it's essential move to 100% pasture-fed livestock, as well as pasture chickens as well, if we're wanting to improve the nutritional quality of our meat, milk and eggs. And just to say that the Bionutrient Food Association in the States, they're just about to start a really interesting project where they're going to be getting samples of meat, milk and eggs sent in for full laboratory analysis, to then link back to how they were produced, you know, what sort of diets those cows and chickens were fed. So again, it's the how can we produce the highest quality of meat, milk and eggs that will have better health outcomes for people.
Yeah. So somebody's just also mentioned the work of Tim Spector, another great voice in the nation. He's written a great book recently about how nearly everything we've been told is wrong in terms of our health advice. He's wonderful to follow, you know, on Instagram, Twitter. He's doing some amazing nutritional research with the same messages. It's about gut health, it's about plant slant, it's about quality produce that impacts health outcomes. It's about personalized health. Like, you know, men are different to women, races are different. We need to personalize this. So yes, another one great to follow. There's a question here for Eilish. How can we make nose to tail appeal to consumers? Many farmers will be glad to hear you advocating for the nutritional benefits of liver and heart, but I imagine consumers recoiling in horror at the thought. What are your thoughts on that?
It is a difficult one, and in terms of trying to introduce something like heart or even liver, actually, I don't know if you've tried this, Sally, but actually slow cooking things like heart will actually, you know, change the taste and the texture, and it gets rid of that sort of tanginess that people really recoil from. So I will try, if people are, you know, happy to try something new, get the slow cooker out, you know, curried heart is actually really nice. But on another level, the way that it could potentially be used is that we have supplements, they're quite expensive supplements, but these are, you know, capsules where you have like the dehydrated form of the organ meats in a capsule, so it can be taken as a supplement. It is potentially maybe another way to go, that people can have it in their diet, don't want to eat it, but the benefits are huge. And you know, there's been so much about, you know, scaremongering, I think, as well, about liver. Obviously there is an upper limit that we should eat in terms of vitamin A, but vitamin A has not been given the same press as vitamin D, and we need both together. They're so important. And we also know as well that with vitamin A, that up to sort of like 40% of the population have inbuilt genetic inability to convert beta carotene to the form of retinol that is available for the body. So in terms of why do some people do well in a plant-based diet alone and some people don't, and vitamin A is so crucial, like I said before, for immunity. So this is why I do encourage, you know, organ meats as part of the diet, and again for Pacific, things like coenzyme Q10, which, you know, for people who have long COVID now as well, are really important for that mitochondrial health. But yes, that balance of like how we encourage people to make that step. I think there could be room for you know, forming supplements which people can take from local regenerative farming practices. Actually, you know, when the meat's been harvested, it could be turned into a supplement. Basically, that's
I mean, it's that whole thing, going back to what Laura said. It's massively challenging to get people to transition. When I worked in Africa for 4 or 5 years, like their approach to particularly in Sudan and Uganda, their approach to meat is actually they always ate all the offal, they always ate the heart, they always ate the bones, and quite frankly, they'd throw away the fillet. They thought that was the crap bit. And it's instinctive because it's so nutritional, and we have subverted that in the last 40 years, and we've given this message that, you know, white, highly factory farm chicken breast is the healthiest. Certainly I wouldn't be feeding it to my kids now I know how they're grown. And it's just undoing that, you know. Same with saturated fat, same with this low calorie concept. Like, it's massive. We have been indoctrinated with what is healthy and what is acceptable and what is, you know, tasty, and it's a huge challenge. And we can bang the drum that bone broth is the way forward and organ meats are the most nutrient dense foods, you know, in the planet, but there is that side around helping taste that.
It's Sally, it's also like the visual representation. So you have the plate, which we know is not the way forward in terms of health, and it's the fact that meat is always represented as that piece of fillet or whatever. You never see organ meats alongside, you know, the muscle meat. We're not used to seeing it visually in advertising anything. It's just like a non food. It doesn't exist. It's something wasted, thrown away, or given to the dog or something.
Can I just come in on like traditional varieties of vegetables, you know, if we're sort of talking about traditional eating, and really wanting to flag up the importance of using traditional cultivars actually in reversing type 2 diabetes. So I'm just going to quickly highlight a really interesting study that's just been published by Thora et al. In Denmark, published in May. And it shows that traditional cultivars of cabbages and root vegetables, which are rich in bitter and strong tasting phytochemicals, significantly improved the health status of type 2 diabetics compared with equivalent modern mild and sweet tasting vegetables. So it's really, you know, it's showing that we've actually like bred out the qualities of the food that are the most beneficial for human health.
Yeah. Thank you, Laura. Laura, did you want to make comments? Because I'm sure that's very passionate in you as well, some of this challenge.
Yeah, I was just going to say that Eilish made a really excellent point, and it speaks to a broader psychological theory called social norm theory, where, you know, it's, on the one hand, it's about this kind of explicit education type stuff that we've kind of been talking about, so that people know about the health benefits, but it's also about this kind of implicit thing that Eilish just spoke to about representation, which is that, you know, if people see this representation and they see that as a norm, and they think that other people are eating these things, then that has an implicit psychological effect on what people are, what consumers are accepting of, and that's got nothing to do with what people know about the health benefits and what they just think is a normal thing to eat. And you know, the well plate is a really good example, Eilish.
Great, fabulous. So we've got 4 minutes, and so we just wanted each of you to give a one-liner of what is your key message to this wonderful crowd, that they could take away with them. So shall we start with Eilish? What's your thing that you would love people to take away?
Oh gosh, I think mine's a bit depressing. Sorry. Well, yeah, I mean, I feel we're still vulnerable as we are at this time, as long as the prevalence of impaired metabolic health is so high. But, you know, with that as well, it should be noted that people with normal BMIs, especially exposed to chronic stress, can have impaired metabolic health. So we shouldn't be, it's not about fat shaming, anything like that. That really has to be put into context. But yes, it is about moving away from the standard westernized diets, embracing real foods. And I find that a positive, and that's something that we need to educate our children about as well, and tastes and flavors. So yeah.
Fabulous. Elizabeth, what's your
Yeah, thank you, Sally. Well, I would like to finish with Griffin's 4 key advocacy messages, actually. So the first one is we need to shift from a narrative of always focusing on food quantity based on yield to food quality based on nutrient density. Second message, I would like us to shift the narrative from food security to nutrition security. And I'll share some links on this so you can sort of become aware of the difference. We need to shift also to not just thinking about a right to food, but a right to nutritious food. And finally, the fourth message is we must start using food as medicine to reverse and prevent these diet-related non-communicable diseases. So thank you very much.
Thank you, Elizabeth. And Laura?
My message is really that if you are innovating upstream and you're investing in your product, whatever it may be, try to think about the consumer early in the innovation process, not late, because that's what the people producing ultra processed foods are doing to their benefit. So really try to consider the consumer early, not late, is my message.
No, that's totally brilliant. And for me, like, my passion is lifestyle problems require lifestyle solutions. Get a good night's sleep, hug somebody, go for a walk, eat some real food, and manage that stress. And you can start shifting away from disease to health and experience human flourishing. So it's been a joy to be part of this. Thank you so much. All these speakers have given their time, their morning to us this morning. So thank you, Elizabeth. Thank you, Eilish. Thank you, Laura. And we wish that you a speedy recovery, Laura. Thank you so much. And it's been a pleasure to be part of this. I've popped on there how you can get hold of me. I know in the slides you guys have also put ways to contact you. If you want to maybe just pop it in the chat so people can get in touch with you or follow you on your social media. But yes, thank you so much for attending and for your questions.